Hi, my name is Collin McGuire, and I am a student at Arizona State University. I've been taking classes about HIV, and today I'll be putting together a brief video about HIV treatment. So, untreated HIV will develop to AIDS in around 8 to 10 years. Once a person's immune system has degraded to the level of AIDS, it's very hard to recover back to the normal immune system. In fact, even if a person gets the proper treatment, they likely will never recover to the same level they were before they contracted HIV. And at that point, once a person has developed AIDS, their immune system is weakened to the point where they will start to develop opportunistic infections, which are infections that a person who is healthy would normally never get, but only because their immune system is compromised, as a person with HIV develop opportunistic infections. And if left untreated, once a person develops AIDS, they will die anywhere from 6 to 18 months. There are a couple exceptions to people developing AIDS within 8 to 10 years of HIV infection, and those are the long-term non-progressors. And there's about 1% of Caucasians who have this mutation, and it's a mutation in a gene that makes it harder to get infected with HIV, but also to develop AIDS usually takes anywhere, instead of taking 8 to 10, it's maybe 20, 30 years or so. It just takes a lot longer for that person to develop AIDS. So at this point, it's a good idea to go into how AIDS and HIV are treated. So the treatment for HIV and AIDS right now is called HAART, which stands for Highly Active Antiretroviral Therapy. And HAART is a drug cocktail of around 3 or 4 different antiretroviral drugs. And there's many different classes of these antiretroviral drugs. The important thing is all of them work have different methods, but they all achieve the same result, which is working to suppress the viral load and viral replication of HIV. So if the antiretroviral drugs are taken properly, a person's viral load count will drop to undetectable levels on the tests, and a person will be pretty much able to live a completely normal life. They won't have any symptoms, they will suffer barely any side effects, and they won't be able to easily spread HIV to anyone else. So if a person is able to take these antiretroviral drugs with HAART, a person's life will be basically as if they didn't have HIV at all. However, these antiretroviral drugs need to be taken extremely consistently. This isn't a case where it's just you take something twice daily, and you can take it at 10 a.m. one day, 11 the next day, 8 a.m. the third day. Antiretroviral drugs need to be taken precisely at certain times throughout the day. So one example would be a person has to take their antiretroviral drugs at 9 a.m. and 9 p.m. daily. And if a person is able to maintain around a 95% efficiency rate taking their drugs, the antiretroviral drugs will work, HIV will be suppressed, and they'll be able to live a normal life. However, if a person can't maintain that 95%, it is worse. There are worse consequences than just the virus being able to replicate. If that 95% isn't maintained, HIV will likely mutate and become immune to the drugs that were being used. In the United States, this isn't as big of an issue as it is in the rest of the world, as there are around 30 or so antiretroviral drug options available, so the patient can get different antiretroviral drugs as the ones they were on before the HIV virus in their body is now immune to. However, in other parts of the world where there isn't as good of access to antiretroviral drugs, this is a much bigger issue because they might only have 5 or 6 viable antiretroviral drugs, and if 3 or 4 of them don't work for a person, that person can be out of luck and not be able to do anything else to treat their HIV. So it's very important for people on HIV to make sure that they stick to their treatment regimen and do not get off track. And finally, I mentioned this a couple times before in the video, but if a person develops AIDS, they'll begin to experience opportunistic infections. So which opportunistic infection a person develops has to do with where that person is located. In the United States, a patient will most likely develop pneumocystis gyrovecii pneumonia, or PCP. Around 90% of patients in the U.S. will develop this opportunistic infection. However, in the rest of the world, the biggest opportunistic infection is tuberculosis, and it's one of the reasons why tuberculosis is a big killer in the world today. So beyond ARVs, antiretroviral drugs, patients can also be given a prophylaxis, which will help treat the symptoms of their opportunistic infection. So probably the most common prophylaxis drug is Bactrim, which some of you may have heard about if anyone you know has gotten a UTI, as it's also used to treat that kind of infection. So Bactrim is a drug with a pretty wide range of applications, and it's very useful in treating opportunistic infections in people with AIDS. And this prophylaxis is pretty effective, and it reduces mortality in patients by about half, and is really effective in stopping malaria and just hospital visits in general for patients. So that's pretty much the three big things you need to know about treatment for HIV. First one is that treatment is very important. If a patient is not treated, they will develop AIDS and then eventually will die from a lack of treatment. The second is that the adherence that's necessary for treatment. If treatment is not adhered to properly, patients will develop a resistance to the antiretroviral drugs they're on, and depending upon their situation, this can be deadly. It can have deadly consequences. And the third thing to know is just about opportunistic infections, what they are, and what the most common way to treat them is. And thanks for tuning in.